This is, I think, important for all of us because we all want to be collaborating. And this is an older talk I'd given a while ago, basically looking at what the clinical benefits are of multidisciplinary talk. It's going to involve all treating clinicians, urologists, medical oncologists, radiation oncologists, and primary care physicians, as we've seen as well, who've been participating in this meeting in the past, because you're going to have to manage these patients medically. Now the new med docs are involved as well with Pluvicto and other folks, but we have to really look at this as a team approach with everybody, because as we saw from the first day, there are going to be effects of androgen deprivation therapy. Nutrition can help that. I've seen patients with who are treated with ADT who've had psychotic breaks, who become extremely depressed. So we need mental health care professionals to help us. And then pain management at the end of the course of disease, which is going to be helpful. So what's the value? There's not a lot of data on this, unfortunately. And the two places that have really generated data are Thomas Jefferson with our good friend and colleague Lenny Gamella and University of Colorado when Dave was at UC. And what was found was that if you start looking at the SEER data, comparing this in men who have locally advanced and high-risk disease, that you can see stage per stage that there is a better outcome for those patients who have the multidisciplinary approach. And that includes, again, an oncologist, a radiation doc, as well as a urologist. And also, there seemed to be an effect on survival in the region in this same group of patients in Colorado when the multidisciplinary approach was used. So we've got a lot of challenges with healthcare. As you probably have seen in the news, a lot of the major institutions are losing money. And the healthcare system potentially could be bankrupt. I mean, Medicare has got its issues. And so we need to optimize our patient outcomes. Who are the best patients to receive these treatments? We can't afford to use all these novel treatments on everybody, and we have to become more specific, and I think this is where precision medicine is going to be very, very important for all these specialties. So improving access to specialty therapies as well. I mean, there's a tremendous amount now about access of care to different minority populations. That's going to be important. That's going to improve our outcomes. Efficiency both in patient and clinician schedules. I think telemedicine's helped this a lot. I think that's been one of the few, I think, positive things about the pandemic, that we can now talk to our patients via video, talk to them about the different test results. They don't physically have to come in, and that's especially important for elderly patients. So avoid redundancies, and again, with the internet, we can improve the patient survivorship. But I also think that this is one of the biggest impediments to good patient care, depending upon how it's used, because we don't talk to each other. We use a text message, we use emails. It doesn't have the impact of saying, this patient's in severe pain, you need to see somebody. So you can use this as a great tool, but it's not as good as the physician talking to each other. So we have a person power shortage in urology and medical oncology. We're going to see that over time. I think, I've seen that in trying to hire other people. There's a pipeline explosion with all these new agents, and I think the way we can maximize the synergies is through multidisciplinary care.